Good afternoon. My name is Wendy Gordon, and I'm a Public Information Officer with the Washington County Joint Information Center. Thank you for joining us to discuss how our Latinx communities are being disproportionately impacted by COVID-19 and how the county and our partners are working to address those disparities. I'm sorry you can't see me. We were having a little bit of technical difficulties today. So a few housekeeping notes to start with. We'll have all attendees on mute the entire session. There will be time for media questions after our three speakers present. To ask a question, please use the chat feature and choose the option that allows everyone to see your question. If it's not obvious from your screen name, please include your name and media outlet along with your question. Please also tell us if your question is for a specific presenter. We ask that your questions be in English, please. If you're interested in having an answer in Spanish for your broadcast, we will allow time for those questions at the very end. We are recording this press conference and will post it on the county's YouTube channel, website, and social media this afternoon. We'll also be sending out a press release shortly after this presentation ends in English and in Spanish. Let me introduce our three speakers and then we'll get started. First, we'll hear from Marnie Kyle, who served for many years as a public health nurse and is the director of Washington County Health and Human Services. After Marnie, we'll hear from Maria Caballero Rubio. She's the executive director of Centro Cultural. And finally, we have Layla Garside, who is a service manager and cultural liaison with Salud. Marnie, we're gonna unmute you and we'll get started.
Okay, great. Thank you, Wendy. Thank you everyone for joining us. As you already know, COVID-19 is hitting our communities of color hard. That is true in many states across the country, including New York, Michigan, California, and right here in Oregon, where 27% of the state's confirmed coronavirus cases are from the Latinx community. And if this virus were affecting our residents equally, the number would be more like 13%, which is closer to the state's percentage of Hispanic persons in our communities. Here in Washington County, the disparity is even more stark. More than 16% of our residents report that their ethnicity is Hispanic, but almost half of our residents who tested positive for COVID-19 are Latinx. This is 3 times higher than you might expect if this virus were affecting our community in equal numbers. We need to know much more. We need much more testing to know the true distribution of the disease, but we are extremely concerned that our Latinx community seems to be disproportionately affected by coronavirus. It's not surprising given the systemic inequities that our Latinx residents face every day, with less access sometimes to healthcare, education, and economic security. Many of our Latinx residents don't have the privilege of working from home and staying safe. They are caring for our elderly in long-term care facilities. They're working to harvest the food our community needs, and they're working in grocery stores and restaurants to be sure that that food makes it to our tables. In fact, more than half of the Latinx community members who tested positive for COVID-19 reported working in outdoor labor, factories, warehouse workers, as healthcare providers, in the food service industry, or in grocery stores. These essential employees put themselves at risk of coming into contact with coronavirus simply by going to work. Last week, the newly formed Oregon Latinx Leadership Network, made up of over 70 Latinx-led and allied organizations, many from Washington County, called on state leaders to do more to address the uneven impact of COVID-19 on Latinx and Indigenous people. In Washington County, we support these efforts, and we are working with our own community partners to help educate our community and slow the spread of this disease among our Latinx community residents. For example, we are working with community health centers to make sure testing is prioritized and available for communities of color and residents without health insurance. We are running Spanish ads, Spanish language radio ads to educate, especially essential workers. We are conducting public health outreach and contact tracing in Spanish and in English or other languages as needed. We're developing recommendations for growers to protect farm workers and delivering food and hygiene supplies to migrant camps. We also converted a local motel to a shelter for houseless residents recovering from COVID-19, and our business assistance program focused on supporting underserved and small businesses. We couldn't do any of this work without our community partners. Virginia Garcia Memorial Health Center and Neighborhood Health Center are offering health services and COVID screening in our Latinx communities. And Centro Cultural, an organization that has supported our Latinx community for nearly 50 years, is working diligently to reduce disparities during this pandemic. We are very lucky this afternoon to have Maria Caballero Rubio, Centro Cultural's Executive Director, joining us to tell us more about what her organization is doing. Thank you, Maria, and I'll turn it over to you and then Layla.
Thank you, Marnie. And my name is Maria Caballero Rubio, for the record. So like most small businesses and nonprofits, we closed our offices on March 23rd and have people working remotely, responding to community needs over the phone and online. We continue helping people fill out Oregon Health Plan applications and other services like SNAP and so forth. However, 3 weeks ago, it turns out that we became an essential service and had to bring staff back to help with food distribution and to meet the needs of our Latino elderly population in particular, who are sheltering in place but have other medical needs and food insecurity, need help refilling prescriptions, and helping those that are, for example, coming home from chemotherapy and who live alone, all those kinds of things. So we are back at work in our Cornelius office. Our doors are locked, but we're continuing to meet the needs. As far as our elderly population, we have about 100 seniors who are registered clients at our Meals on Wheels program. So we continue to meet or call them on the phone on a regular basis, at least once a week. And for those that are more frail and ill, we try to call them at least twice a week. We have partnered and have a really good relationship with the Washington County Disabilities, Aging, and Veteran Services. They have partnered with us and worked with us and have provided us with lots of services. We refer people to them, so it's been a really good partnership for us, and we're working very closely together almost on a weekly basis. We're in contact on the phone. We're also partnering with Ride Connection to deliver food bank groceries to 26 of our elders who are seeking, and they're only able at this time to deliver food for elderly and disabled, but we also have families that are low income and are quarantined. Some of them have the virus or family members have it, so they don't have a way to go out and get groceries. So we are delivering it to them. Our staff is going to their door and knocking on the door and leaving it for them. We are also trying to as I said, try to find some funding so that Ride Connection can continue to do that, but to add to greater community. Also, as the weeks go by, we see an increase in the number of elders that are really needing mental health services. We're partnering with Pacific University for this. They have graduate psychology students who speak Spanish and who are able to talk with them. They jump on a call with us, with our staff, just to see if there's any particular need that they might have. They're experiencing loneliness, anxiety. They've lost connection with their families because their families don't come around, don't want to infect them because they're out there working in the grocery store and have kids and that kind of thing. So really it's kind of fallen to us to try to keep them engaged in one way or another. We are partnering also with Virginia Garcia Health Clinic to host their weekly food bank at Centro every Tuesday. We get about almost 200 people queuing up 2 hours before we start distributing food. They had to give up their food bank area in their parking lot because they now have a drive-through mobile testing site for their clients or their patients. So we are doing that with them. Our staff is participating. So as you can imagine, having that many people coming and lining up, it's kind of created some distancing issues. We have started making, we're into our third batch of 100 masks that we are distributing and making at Centro for the community. And so that's working out really well. We are also, another partner that we're working with is a severe winter shelter program who serves Western Washington County homeless population. We're donating our commercial kitchen space for them to come in and prepare meals to go for vulnerable homeless people who may be ill and living out in camps. So we are working with them to hire maybe a quarter-time liaison at Centro to provide service for Spanish-speaking homeless folks. So that's been a really good partnership as well. We do have a Hillsborough office where we provide workforce and business development for Latinos and low-income people to remove barriers to employment. So we continue working with clients on the phone. We continue holding GED mentoring and tutoring classes online using Zoom technology. That's one thing that's really become, I think, for all of us, something that's essential. And so we've had to get laptops for everyone. We've had to train people how to go on Zoom and use that tool effectively. But mostly for the last couple of weeks, that team in Hillsborough has been helping people sign up for unemployment benefits. So far in the past couple of weeks, they helped 234 people apply. Usually people who are not technology savvy, can't go online, have been waiting on the phone for hours before they can apply. So that's been majority of their work so far. We are also out of that office providing support to employers on how to navigate the unemployment system for their employees. 80% of those employers are Latino businesses. And through our partnership with Work Systems, Inc., we are in contact with the Employment Division who provide technical assistance and do a weekly meeting with our staff to make sure that we are helping people effectively to apply. Lastly, we serve the working poor and low income who don't have a safety net. These are folks who are not eligible to apply for unemployment, even though they've been working for decades. They're not eligible for food stamps, for health insurance, for OHP. So we have started raising funds with our Esperanza Fund, which is our Hope Fund. We established this fund back in 2017 to help families impacted by deportation of the family wage earner and to help DACA students renew their applications during those difficult times as well. So we started fundraising thanks to our development team who are wonderful, started fundraising on April 15th, and we have received so far $32,000 in donations. And these are donations that come in $25, $50, $100. So we're really touched by the response of the community. We are now this week putting out our first round to 23 families in the tune of $23,000 for rent and utilities and other needs. And so I mentioned the donor base that we've gotten funding and donors from Minnesota, Hawaii, Virginia, Washington, D.C., New York, Texas, I mean, all over the country, thanks to social media. So we're really grateful and touched, but the most touching thing for me is seeing $25 donations come in from our clients. It's really made an impact on me, and I think that it just shows the spirit of generosity among all of us, and I'm really proud and happy to be a part of this effort. Thank you.
Thank you so much, Maria. We're going to go to Layla now. We're going to unmute you. You're all set.
Hello, everybody. My name is Layla Garside. I'm a registered nurse, and I work at the Hillsborough Medical Center, formerly known as Quality Healthcare. I'm the clinical nurse manager for the Salud program, which is an outreach services provided here at Quality, but is providing services to migrant and seasonal vineyard workers and their family who work and live in the North Willamette Valley. Home base is Hillsborough, but we cover 7 other counties in the valley. So it's a remarkable program. It's a collaborative effort with the Oregon wine industry, who support our program 100% via our Quality Healthcare Foundation. This program has been in existence now for 30 years, providing these vital services to this population. So our department has been very busy. Like many others, we did stop the clinical services, the outreach that we do, which is year-round, temporarily, but we moved into the phone and virtual services, which we've been doing constantly, calling our patients in all the different counties, following up with them, seeing how they're doing, what are their needs, and taking measures to assist them with their questions or the healthcare needs. The other thing that we do with Salud Services is that we are a safety net. In essence, we work with all the federal qualified health centers throughout the valley to facilitate access to healthcare to these workers and their families. We also provide outreach services via our mobile unit, and we're going to start doing outreach services next week. So we head out into the vineyards again to provide outreach services of basic health information on all the questions they may have, the questions the patients may have. We're going to be doing some health exams, and in addition, we are ready to do some sample collection and assessment and sample collection for COVID-19. So we're going to be reaching directly to these workers going into their employers. So we're very happy to report that. As I said, we are a network of services. We collaborate with every social services in their different counties, providing that information to our patients, exchanging information with those agencies, and really coming together to provide us as much information as we're able to do. I am very pleased to see the effort that is taking place here in Washington County with the county health department, with the federal qualified health centers, with all the many other social services such as Centro Cultural, to start talking about how to deal with our Latino community and dealing with this virus. The other thing too that I want to say is that we have an incredible support from our organization, and that's been extremely helpful for us to be ready to start providing outreach services beginning next week. So yeah, that's where we are. So keeping track of these migrant and seasonal farm workers, keeping their employers informed of what is happening, rules, regulations, suggestions, everything that is coming from the CDC, everything that is coming from the Oregon Health Authority, any information that is related to this virus, we are sending that out to the employer, and we are also using social media to connect with our patients, which has been really helpful because they have many questions and we are able to answer them as soon as possible. So in essence, that's what we do here at Salud Services.
Great, thank you so much to all of you. We are going to take some questions now. Feel free to chat those in the chat box, media, and if you have a particular person you'd like to direct your question to, that will be helpful as well. We do have a question from K2. It's a two-part question. Marnie, I think you're probably best suited to answer at least the first part. The first part is, are health officials still seeing community spread in Washington County? We'll let you answer that one first, and then we'll take the second one.
Okay, thank you for the question. So we are still seeing new cases. but we are definitely seeing a decline in the number of new cases each day. So we're really proud and appreciate all Oregonians, and in particular Washington County residents, who are really taking the governor's stay home and save lives order to heart, and maintaining social connections with folks, but staying physically distanced and wearing their face coverings when they're out in public, lots of hand washing, all of those great public health recommendations. Our county can be really proud of itself because the numbers are definitely going in the right direction.
Okay, and the second part of the question is, what steps can state and federal leaders take to help underserved communities? I'm not sure who wants to take that question. Does somebody have a burning desire?
I can answer.
Thank you.
Yeah, so the question, the things that we are doing right now as a collaborative here is to provide a lot of information. The Oregon Health Authority has created a group that is specific to address migrant and seasonal farm workers and other agricultural workers. And we have been working together now for about a month on that group, providing guidance to the state, or OSHA, to the agricultural department, and other agencies of how to approach services to migrant and seasonal farm workers. So there is a lot of health information that has been created by this group. Or the Oregon Health Authority also just created a line or Facebook page, I believe, strictly in Spanish, that people can go and access that information. So there is a great effort going on to address at least the migrant and seasonal farm workers in the Latino community.
Thank you. Maria, did you want to add something? You're unmuted, but I can't hear you.
Okay, can you, okay.
Yes,
Yeah,
there we go.
So in terms of the question about what government can do, I think that especially right now when we're in the middle of the pandemic, I think that we need better and more communication with local governments, state governments, to really get the latest on what's happening. Too often we end up hearing information 2 or 3 days later, and the information we're giving to the public is no longer current. So I think more and continuous conversations bring us to the table. Don't plan for us, plan with us, because we're, so to speak, on the ground working with folks. We hear what's happening, we hear what the needs are, and just like things are changing with the virus and with the response by government, things are changing on the ground with families and their needs too. And so we can really learn from that. Lastly, I think that we need to be providing community-based organizations the opportunity to disperse funds or services or food or whatever at our level to make it low barrier. You can provide all the funding you want, but if people aren't going to go to that building or that organization or that government building, they're just not going to get served. So I think at least during these times and ongoing actually, to really create better and closer partnerships with your nonprofit sector, because I think that we work really well together. And so during this time of pandemic, I think it's even more vital.
Great, thank you. Do we have any other questions? Very surprising, only one question from K2, or 2 questions from K2. Does anybody else have any other questions they'd like to chat in? Going once? Going twice? Yes, we have Rich from the New York Times. Let's see, we're waiting for it to come through. Everyone can hang tight. New York Times, folks, New York Times. How many seasonal farm workers have tested positive?
So This is Marnie, and what I can tell you is that of the folks that have tested, the Latinx community that has tested positive, the level of information that we collect about their work is that we know some of them are definitely outdoor laborers connected to agriculture. We have not specifically collected data on whether it's a migrant position, but we definitely know that they're in positions that they aren't able to stay home and stay safe, that they are in places where physical distancing can sometimes be more difficult, where hand washing stations may not be as easily accessible. And so they are really doing essential work to keep us, our families cared for, and to keep the food system working well.
Okay, thank you, Marnie. Our next question is from KPTV, Simon. He says, Marnie addressed this briefly, but could she expand again on why the Latinx community is so disproportionately affected? So is there anything else you could add, Marnie?
So I think that, oops, I'm echoing. Okay, so I think that what's really important is that this pandemic really brings into sharp focus the systematic social, economic, and health inequities that already exist in our Latinx communities and in our general communities of color. These are inequities that they face every day. The other thing I think is that we have talked about is that these residents are really the heroes that are going into high-risk situations and going to work each day, making sure that our loved ones are cared for in nursing homes or hospitals, making sure that our food is harvested, that our grocery stores are stocked. So they are the heroes that are not able to go and protect themselves by staying home and not going to work. So just going to work is putting them at risk. And then the third comment that I would make is that I think Maria explained it really well. We are really concerned that our at-risk Latino families are not getting all of the information that we want them to get about how to protect themselves. And we want to do a better job of partnering with our local community-based organizations and, as Layla talked about, with our growers to get that information out to folks.
Okay, thanks, Marnie. We have a question from El Latino de Hoy newspaper. The question is directed at prevention and where our community could have a COVID-19 test by counties. And as the public information officer, I can tell you that we actually just added testing information to our website. If you do go to our website, which we can provide later, there are some testing sites, including for the general public who does have symptoms. But I don't know if anybody else has anything to add to that question.
Could you repeat the question again, please?
It says, but my question is directed at prevention and where our community could have a COVID-19 test by counties.
Okay. Wendy, the only thing I would add to your answer is that the testing capacity is improving, which is a really good thing. But private organizations that are doing testing aren't required to report to the county when and where the testing is happening or who they're testing. And so I think, you know, the Emergency Operations Center is doing the best job they can as they learn about testing opportunities of including that on our website. But we don't always know.
Okay. We have another question from Rich at the New York Times. Layla, I think this one will be for you. Are you worried about what happens to the migrant farm worker community when the harvest starts up next month?
Well, again, we are making efforts to address that issue about for migrant and seasonal farm workers. As I said, here in Oregon, anyway, we have started early addressing this, bringing awareness of how to mitigate this issue, working with the county health departments, working with the Oregon OSHA Health and Safety Administration to put some guidelines or improve the current guidelines for field work sanitation and for housing. And so that is already in place. Today, or OSHA released some interim guidelines that will be taking place May 11th for the growers to have those guidelines. And here locally, in collaboration with our county health department, we have taken upon ourselves to also do some, go an extra mile and provide more detailed information to the local growers on how to do that. And for the thing that I do, which is working with vineyards and wineries across in the valley, the things that we have done is we have been providing information since this began. It's now, we're going out for 2 months, maybe a little bit longer, providing information about social distancing, about masking, about hand washing, about all the safety precautions that they need to take at the work site, and they are already being implemented. Of course, you know, Oregon is bountiful. I mean, we have an amazing agricultural section. So we're going to have more migrant and seasonal farm workers arriving in our state. And so that's what we are preparing for, how to mitigate the spread of this illness and have the growers be ready to host these workers that many of them may be staying at their properties. So so that's the thing that we're doing, just to be proactive and providing some guidelines that they can follow to decrease the spread of this illness.
Thank you, Layla. Next, we have Stephanie from Bustos Media. She says, we are seeing that our Latina population are affected because our undocumented people think that they can't get tested because they don't have papers. What are you doing to get the word out to let them know what's available out there for them?
So I can start, and I think Layla and others may have more information, but we at the Public Health Department, we have been working really closely with Virginia Garcia and Neighborhood Health Center, our two federally qualified health centers, to help get the information out to folks that they can receive testing. But because there continues to be restrictions, it's getting better, and we have more testing available, but there's still a requirement for a doctor's order, and that people have symptoms of COVID. We're not able to test asymptomatic. It's not widespread availability yet, but we are trying to get out the information that that the federally qualified health centers are providing that kind of testing for people, and you don't have to have insurance, and you don't have to have be documented resident. And Layla, I don't know, I know you all are doing a lot too, so.
Yes. What I will add to that is that, yes, we are providing that information to our patients and to the family members that there is a process to get a screening. If they are patients, already established patients of the federal qualified health center, that they can make an appointment directly, talk to their provider, and be assessed whether they qualify to come in and have that test. And I know the clinics are doing a big emphasis on that. They're communicating with their patient base and passing that information. And we're going to be doing the same thing with the Salud program. We are going to start screening patients based on the new guidelines that the Oregon Health Authority has given us. And so we're going to use those guidelines and include also ethnicity. And again, most of the workers that we're going to see are Latinos. We're going to be asking other questions, and if they meet that criteria, we will provide that test if that test if they agree to do so. So we're going to really encourage them to participate and to take advantage of these service that we're going to be providing starting next week.
And
Great.
I will add that we also try to put out as much information as we can. The federal government does have a website where they're constantly putting out information, and we put it out as well, that really says to the community, if you have symptoms or if you think you have the virus, go in and get tested. Any kind of medical services that you incur will not be counted against you for public charge. And we're really trying to get the word out to folks. But this goes back to the systemic fear that's been happening in our community for years, and most recently for the past 3 years, is that people don't believe it. They're afraid. So they don't go. They would rather just not go and put themselves in jeopardy. Even us, when we're trying to take application from folks to give them some money that's not tied to government at all, they'll give us the zip code where they live, but they won't give us their address and those kinds of things. So people are living in fear even more now. So when we talk about, people's weakened immune systems, they've been weakened for years, and this is just adding to that. But again, I think it has to do with that fear of government, fear of accessing services that they're not eligible for normally.
Great, thank you. So it looks like we're only going to have time for one more question before we turn it over to a reporter who wants to ask a question with a Spanish answer. So the last question that we will have time for right now is from Molly Harbarger. I believe she's with the Oregonian. And she asks, will there be consequences for employers who do not follow the guidelines you mentioned about sanitation and hygiene measures?
I have not read the interim guidelines that OROSHA just provided today in the meeting that we had this morning. But I'll have to say that the OROSHA will be ready to go and do inspections as necessary. Again, working in collaboration with the local health departments and their different agencies. I mean, I imagine that they have a plan in action, a plan already in place to manage that if the need comes.
Thank you. So if we didn't get a chance to get to your question, we apologize, but we did put an email address in the chat box for the media, if you can see that. And we'll also be sending out a press release with additional contact information for Centro Cultural as well as Salud. We did want to give an opportunity for Carmen to ask a question. She's going to ask a question in English, but she's looking for her answer in Spanish. So Carmen, did you type in your question? I don't see it quite yet. We could also do this offline, Carmen. If you want to send an email to Mary Sawyers, who's in the chat box, we can arrange for a separate interview by Zoom with any of these folks, right? Can I offer that up for you, Maria, Leda, and Marnie? Oh, there she is. We have her now. We have her now. So the question is, what are the statistics within the Latino community in these counties that are Latino?
Not sure I understand.
I'm not sure I understand the question. She's looking for statistics on Latino community. Maybe Marnie, if you could help, if Ava could help you answer that, the statistics.
Sure. I think what we've mentioned right now is that in Washington County, 49% of our positive cases have been within the Latino community. They self-identify as Hispanic.
Hey Marnie, I'm sorry. Is Ava in the room with you to help interpret?
Yes, that's why I'm pausing a little bit so that she can.
Where is Ava? Because I don't.
Oh, Ava is on Mary's laptop.
Well, but we have her muted and no video because we didn't know that. Okay, so we're gonna find her.
So I may say that if there is under the Oregon Health Authority under COVID-19 in the webpage, you will find a specific information about race and ethnicity by county, I believe. But if not, there isn't there. They're collecting that information, and so it's there.
And what I would add is that when we release the press release, the data dashboard will have more detailed information. But Ava's on now, so I think that she can share in Spanish what basically our data is showing, that 49% or 232 of our 475 cases self-reported as Hispanic.
Okay, so according to the information, I'm going to be interpreting what Marnie is responding to the question about statistics in Washington County. La pregunta que hicieron a Marnie Kyle, directora del Departamento de Salud y Servicios Humanos del Condado de Washington, es acerca del porcentaje de personas de la comunidad latina que están infectadas. Y es 49% del total son de procedencia de la comunidad latina o hispana. Y los datos completos van a ser publicados en en el comunicado de prensa más tarde. Is that answering your question? ¿Está respondiendo su pregunta?
Ava, thank you so much. This is a little complicated. Sorry that this isn't working out quite perfectly, but like I said, you have opportunity to reach out to us individually through the contact information that will be in the press release.
Hopefully that.
¿Hay alguna pregunta en español que necesitan? ¿Algo en particular?
Okay, so I think at this point we're gonna wrap it up. Thank you all for your participation. We're gonna be sending out that press release in English and in Spanish with contact information for all three organizations represented today. Ava Aguilar, thank you so much for stepping in for a moment. Again, we appreciate your time, and we will talk with you.
No problem. No problem. Thank you.
Thank you.